Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org.
Love Boise State Public Radio podcasts? They are free to enjoy, but not free to produce. If you can give, your support helps keep shows like Idaho Matters and Scandalize available to everyone. Donate now at boisestatepublicradio.org.
From the studios of Boise State Public Radio News, I'm Samantha Wright filling in for Jim Gaudette. It's Idaho Matters. First responders in Idaho are few and far between as the state suffers from a shortage of the people who are first on the scene in a medical emergency, especially in rural areas where many are volunteers. And getting the training they need has been hard too, as EMS and paramedics usually have to travel out of state to places like Salt Lake City, Seattle, and Portland for hands-on education. And to fill that gap, St. Alphonsus Health System is holding the first ever EMS conference in the Treasure Valley with workshops on everything from how to stop bleeding to pediatric head injuries to performing a blood transfusion before a victim gets to a hospital. Joining us now are St. Alphonsus Trauma and Acute Care Surgeon, Dr. Ethan Taub, and Canyon County Paramedics Division Chief of Training, Jade Pearsons. Hello to both of you. How are you today?
Doing great. Thank you for having us.
Doing well. Thank you so much.
All right, Ethan, what do you do on a regular day? Tell me what your regular day is like.
So as a trauma and acute care and critical care surgeon, I take care of our region's sickest patients who require trauma surgery, emergency general surgery, and I take care of critically ill patients in the intensive care unit.
And you end up operating, I'm guessing, on a lot of people who come through the doors of St. Al's in an ambulance. So how important is it to you to have those well-trained first responders?
Well, trauma is the leading cause of death of patients aged 0 to 46 in the U.S., and their care starts with our pre-hospital personnel. Without them, I cannot do my job.
Wow. Jade, what do you do on a regular day?
I facilitate the management and training here at Canyon County Paramedics, and then I also help as a liaison between all the different hospitals and facilitate a lot of trainings like this. We also train the rural department, so we help out with the rural departments that fall within Canyon County.
Wow. And I was looking you up, Jade. You developed Idaho's Tactical Critical Care Scope. What is that, and what does it mean?
So we have TAC Med, so we're a select group that covers down on specific SWAT operations and gives them on-scene medical advantages, and those guys can have a little less resources and less time to travel. So I spent the last couple of years improving their scope to more of a critical care level. So they carry blood, chest tubes, finger thoracostomies, and then we wanted to make sure it wasn't just for us. For a lot of that, you have to go to the Board of Physicians to get exemptions to be able to do those skills because they're outside of our range. So instead of doing that, we just helped develop the whole protocol for the state. So anyone that met the same training guidelines we did could have the same scope on anywhere in Idaho that's also covering a SWAT team and meets those same training requirements.
Jade, it sounds like you really plugged into, first responders, paramedics all around the state. How big of a problem is it with first responders? I've been reading things about folks who volunteer, folks who are aging out, just not having enough money, not enough people who can come and do the job. Are you seeing that on a day-to-day basis?
Oh, yeah. Funding is always an issue that you'll see across the board, and as things change in legislation and the funding shifts, and you end up having to go back for that. But I think the biggest change we've seen is the EMS doesn't seem to be a 20-year career for most anymore. We're averaging 3 to 5 years on whether burnout, turnout, or switching to different careers. So, and that's runs pretty true from wherever we've seen is that you're not seeing people want to stay in as long and they're looking for other careers after 5 years. So training becomes a lot more important, and being able to get them trained early to be able to get the most benefit and time out of the small career you might have of those people before they move on. You're just not seeing the 20-year career guys as much as anymore.
It's not an easy job.
Yeah, and then making sure you're trained to do it right helps prevent some of that. When calls go poorly or with lack of training, it definitely wears on the mentality a lot more than feeling trained and confident in what you're doing.
Okay, so Ethan, how important is a conference like this to get some of these folks trained up and to continue folks training who are, already doing this but need that continuing education?
Yeah, this is a really, really fantastic opportunity to bring this conference here right at home to Boise to uh, to continue that education, to continue that training, so that, like I mentioned in your last question, I cannot do my job unless our pre-hospital personnel get the patients to me alive. And so, continuing education, continuing to grow and teach the latest and greatest. This is an opportunity to really do some great outreach and have everybody in the same room together to continue to provide quality care both before and within the hospital setting.
Jade, I saw one of the workshops at the conference is pre-hospital blood implementation in the Treasure Valley, and you're teaching it. I also saw you created Canyon County's pre-hospital blood program. So tell us what that means. What is pre-hospital blood and why is it so important?
Yeah, you're seeing that kind of shift in importance across the country. You saw that shift in Texas, and getting blood to the pre-hospital can make a huge difference in these trauma patients. And so being able to push it through is a logistics problem in general, and then a scope problem. So we ran into the same issue. So in that process of building the TACMED scope, we also got blood administration dropped to base paramedic level. So in preparation for this. The second problem becomes logistics, is getting it from the ability to do it. Blood doesn't last all that long. Whole blood only lasts about 21 days at best when you get it from somewhere. And with such a scarce resource, we don't want to waste it. So the only way it was successful at all is in partnering with St. Al's and being able to work with hospitals that we can work with their blood bank. So we built a program that basically will loan out a couple of units of blood from St. Al's and carry it on our actual ambulance and take it to scene. And we find is that just giving pre-hospital blood earlier on actually lowers the amount of blood required and increases stability. So they're a lot more stable when we're able to get them to the surgeons that have a lot better chance of turning them around. And so working through all that, we initiated it about 2.5 months ago, and I've already given it to 5 patients with better outcomes just through that process. And so I'm teaching it in the conferences, just like with everything else we've done in ALS, is trying to help the state as whole increase. And so just sharing everything we've learned and give the rural and other agencies in the state an opportunity to learn from not just us and how we did it, but from the doctors that help facilitate it. And so they have a better chance of spreading the effect we're seeing and the increase in patient survival across the state, not just isolating it here at Canyon.
Wow, that's amazing that you're already seeing results like that. That's wow. But I mean, there are all kinds of topics and things that you're teaching. Ethan, you're teaching. Let me get this right: geriatric trauma, grandma versus gravity. I think I can take a guess, but tell us about this class.
Yeah, we're going to be talking about our geriatric trauma patients, who are a very vulnerable patient population. They suffer an increased mortality from injuries that a younger cohort of patients would never die from. So the number one mechanism of injury in our older patients are falls. That's why the catchy name. And so we see a lot of patients who are living longer. Our patients are, life expectancy is expanding. Our patients who are, 70 is the new 50. And so we're seeing 70-year-olds riding ATVs out there on the ski slopes, and even older patients. And so improving the quality of care we can provide to them for better outcomes is the main crux of that talk.
We're speaking with St. Alphonsus Trauma and Acute Care Surgeon Dr. Ethan Taub and Canyon County Paramedics Division's Chief of Training Jade Parsons. And we're talking about the first ever St. Alphonsus EMS conference. It's coming up this week. Some of these workshops, like I said, appear to be new techniques or maybe updates on old ways of doing things. So Jade, how important is it for your paramedics to keep getting this new training?
Oh, it's always important. Medicine's always changing and evolving. And just with the infrequency of calls that different medics can get, if we don't train on some things, you could go years without seeing that, and it's easy to kind of forget. I think the awesome part about this agency is, not this conference, is that we have bigger agencies that have a training department like me that can focus on those things that we're missing, whereas you have rural agencies that might not have a training department. And us pooling together for like resources like this not only helps agencies like ours, but it helps all those agencies that don't have that training capacity to be able to make sure their knowledge is up, ready to save people.
Is it going to make a difference to have it here in the Treasure Valley instead of having to travel out of state to get training like this?
Oh, definitely. Many of the agencies that can't afford a training department have the same issue in affording travel. So it ends up falling on the provider themselves to be able to get to these conferences. And with pay gaps and disparity, that's not usually as accomplishable as it sounds.
Wow. And Ethan, how big a deal is it to have this conference in the Valley like this for the first time and the first annual?
I'm really excited for it to have this right here at home and make it very accessible for our first responders, to have other physicians from St. Al's to make it easy for them to come to the conference and interact with our EMS personnel. I'm really excited for it.
Okay, Ethan, when and where is the conference and who can come?
The conference is going to be on Thursday and Friday. That's the 16th and 17th of April at the Stucco Center at Boise State.
Wow. Well, this has been really amazing, and I like, especially Jade, when you're talking about doing a whole statewide look at things as you've been working on with different projects. That this is a great way to get people from all over the state in one place to like you said, share that information.
Yeah. That's the way we make big changes like that, is to get people and share the info and be able to collaborate and share contacts.
Okay. Well, I want to thank you both for coming on the show, telling us a little about the conference and for all the hard work that you do every day. We really appreciate it. Thank you very much.
Thank you. Thank you for having us.
Yeah, thank you so much.
We've been speaking with St. Alphonsus Trauma and Acute Care Surgeon, Dr. Ethan Taub, and Canyon County Paramedics Division Chief of Training, Jade Parsons. And we've been talking about the first ever St. Alphonsus EMS conference that's coming up this week.
And that'll do it for this episode of Idaho Matters. Make sure you check out our podcast feed because you can find more episodes of topics that might be interesting to you. And for more local news and headlines, make sure you subscribe to the Connector podcast. If you're really enjoying this show, a quick rating or review on Apple or Spotify really helps other folks discover us, and we'd appreciate it. Hi, Idaho Matters podcast listeners. If you're on your smartphone right now, or if you have it nearby, I wanted to pop in to tell you about something to check out. Boise State Public Radio is now on Nextdoor. Here's what that means. Trusted local news, thoughtful reporting, and stories from across Idaho right along your neighborhood updates. If you already have the Nextdoor app, you're halfway there. Just search Boise State Public Radio and hit follow.